On January the 24th, the contact information of more than 2,000 community leaders in Wuhan was posted in residents' WeChat groups. On the same day, the Wuhan COVID-19 Prevention Command Headquarters issued a notice requiring all communities to introduce comprehensive screening of anyone suffering a fever. Transport to hospital was arranged for anyone with a fever. Communities enforced home quarantine for those with mild symptoms who did not require hospital treatment. The capacity of Wuhan's hospitals was nowhere near what was needed. Outside assistance had been promised, but was only just starting to arrive. Community workers were under enormous pressure. Duan Bowen is 23 years old and had been working as a community doctor for just a month when the epidemic struck. The community was quickly identified as the front line in preventing and controlling the epidemic. Community doctors would conduct preliminary screening of fever patients and carry out nucleic acid tests on those suspected of contracting COVID-19 or who had come into close contact with the patient. However, within a few days, Duan quickly got used to being exposed to other people's saliva.
下面的医生年纪比较大的那种的，我们这边是年轻人，我们这边上。年轻人来说，首先你身体什么肯定是要好一点，只要是你做这个行业有这个心。这个是吧？在3楼有一个。你带我去吧，带我。怎么了？可能有点憋着那个了，有点想吐。
Two of Duan's colleagues had volunteered to work at a quarantine facility. A converted hotel, the facility housed 70 suspected cases. The nurses made their rounds 3 times a day to monitor their condition. The young doctors and nurses, all in their early 20s, had never experienced hardship like it before.
刚刚从家里面出发的时候，我们都哭了的。 但现在都还好，都可以坚持住。
On January the 28th, the Wuhan municipal government issued another notice requiring community workers to accompany fever patients to a community clinic or hospital. Under the citywide lockdown, private vehicles were not allowed on the streets. Only cars authorized by a community management office to take a patient to see a doctor were allowed. However, some residents complained that their communities hadn't provided a car for them, and the city's emergency vehicles were unable to cope with a large number of patients.
找到的5吨加工电子没有，这个都是我们自己临时的，都是大的一个。
你们又不是专业人士，这样送，你会有担心吗？
之前的时候有一点担心，但后来就接了几次以后，慢慢的也有积累了一些经验。
哎，你好，是我是339会的。为群社区，我跟你跟居民说好没有？
你把数值给我报一下好吗？
The flood of requests for help was unrelenting, but the community workers kept working.
几乎没怎么睡，早上5点钟才睡吧。
听证的是区指挥部要求我们随时增加，随时送发上医院，我们又增加了8名。
However, the available resources were wholly inadequate, and the efforts to help those in need kept hitting a barrier. To overcome it required a more decisive approach. On February the 10th, President Xi issued a statement. In view of the situation in Hubei and Wuhan, he insisted that everyone who needed it must receive treatment, and that no one should be neglected. In Wuhan, a 3-pronged strategy was adopted aimed at eradicating transmission of the disease. First, mass screenings were conducted, in which a total of 6,326 confirmed and suspected cases were identified among 4.21 million households. Secondly, by February the 16th, new cases were being admitted to hospital within a day. And thirdly, a campaign was launched to gather accurate data on case numbers.